LUTRATE Depot, leuprolide acetate for depot suspension. Please watch the video in its entirety to fully understand the proper use of this device. LUTRATE Depot is a modular device for intramuscular injection of leuprolide acetate. Important safety information. Contraindication. Hypersensitivity. LUTRATE Depot is contraindicated in patients with known hypersensitivity to GnRH agonists or any of the excipients in LUTRATE Depot. Adverse reactions. Most common adverse reactions, incidence greater than 10%, are hot flushes, upper respiratory infection, fatigue, diarrhea, polyuria, arthralgia, and injection site pain. As with other GnRH agonists, other adverse reactions, including decreased bone density and rare cases of pituitary apoplexy, may occur. Please see additional safety information and full prescribing information at www.avyxa.com/LUTRATE Depot. LUTRATE Depot 22.5 milligrams for 3-month administration is indicated for treatment of advanced prostate cancer. Recommended dosing is 22.5 milligrams for 3-month administration with 1 injection every 12 weeks. Do not use concurrently a fractional dose or a combination of doses of this or any depot formulation due to different release characteristics. LUTRATE Depot must be administered under the supervision of a physician. In patients treated with GnRH analogs for prostate cancer, treatment is usually continued upon development of metastatic castration-resistant prostate cancer. Reconstituting. Reconstitute and administer the lyophilized microspheres as a single intramuscular injection. The suspension should be administered immediately after reconstitution. As with other drugs administered by intramuscular injection, the injection site should be alternated periodically. Visually inspect LUTRATE Depot powder, white to off-white powder. Do not use the vial if clumping or caking is evident. A thin layer of powder on the wall of the vial is considered normal prior to mixing with the diluent. The diluent contained in the pre-filled syringe should appear clear and colorless. Use only the provided diluent for reconstitution of LUTRATE Depot. Do not use other diluents. Finally, the reconstituted product will appear as a suspension of milky white color appearance. LUTRATE Depot is packaged in a commercial kit. Each kit contains 1 vial containing 22.5 milligrams of leuprolide acetate as lyophilized microspheres, 1 pre-filled syringe containing 2 milliliters of mannitol for injection, 1 backstop for use with the syringe, 1 mixject transfer device including 1 needle. Preparation of mixject. In addition to watching this video, it is strongly recommended you also read the instructions in the package completely before you proceed. Wash your hands with soap and hot water and put on gloves immediately prior to preparing the injection. Preparing mixject reconstitution. Place tray on a clean, flat surface that is covered with a sterile pad or cloth. Remove the mixject device, the backstop, the pre-filled syringe containing the solvent for reconstitution, and the LUTRATE Depot vial. The entire device consists of the following parts: the plunger rod, backstop, syringe barrel, vial adapter, needle, a vial containing the medication with a flip-off button. Assembling the device. Remove the flip-off button from the top of the vial, revealing the rubber stopper. Place the vial in a standing, upright position on the prepared surface. Disinfect the rubber stopper with the alcohol wipe. Discard the alcohol wipe and allow the stopper to dry. Insert the backstop to the flange of the syringe until you feel it snap in place. Proceed to mixject activation. Peel the cover away from the blister pack containing the vial adapter, mixject. Do not remove the vial adapter from the blister pack. Place the blister pack containing the vial adapter firmly on the vial top, piercing the vial. Push down gently until you feel it snap in place. First, remove the cap from the syringe barrel and then remove the blister pack from the vial adapter. Connect the syringe to the vial adapter by screwing it clockwise into the opening on the side of the vial adapter. Be sure to gently twist the syringe until it stops turning to ensure a tight connection. While holding the vial, place your thumb on the plunger rod and push the plunger rod in all the way to transfer the diluent from the prefilled syringe into the vial. Do not release the plunger rod. Keeping the plunger rod depressed, gently swirl the vial for approximately 1 minute until a uniform milky white suspension is obtained. This will ensure complete mixing of LUTRATE depot and the sterile mannitol solution diluent. The suspension will now have a milky appearance. In order to avoid separation of the suspension, proceed to the next steps without delay. Invert the mixject system so that the vial is at the top. Grasp the mixject system firmly by the syringe and pull back the plunger rod slowly to draw the reconstituted LUTRATE depot into the syringe. Return the vial to its upright position and disconnect the vial adapter from the mixject syringe assembly by grabbing firmly the syringe and turning the plastic cap of the vial adapter clockwise. Grasp only the plastic cap when removing. Keep the syringe upright. With the opposite hand, pull the needle cap upward. Advance the plunger to expel the air from the syringe. The syringe containing LUTRATE depot is now ready for administration. The suspension should be administered immediately after reconstitution. After cleaning the injection site with an alcohol swab, administer the intramuscular injection by inserting the needle at a 90-degree angle into the gluteal area, anterior thigh, or deltoid. Injection sites should be alternated. Note: if a blood vessel is accidentally penetrated, aspirated blood will be visible just below the luer lock. If blood is present, remove the needle immediately. Do not inject the medication. Inject the entire contents of the syringe intramuscularly. Withdraw the needle. Once the syringe has been withdrawn, immediately discard the needle into a suitable sharps container. Dispose the syringe according to local regulations and procedures. To report suspected adverse reactions, contact AVYXA Pharma LLC at 1-888-520-0954 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please see the full prescribing information for additional important safety information.